Hannibal Lecter, Dexter Morgan, and Sherlock Holmes. What do these people have in common? They are all media portrayals of antisocial personality disorder. What is antisocial personality disorder? Antisocial personality disorder is a mental condition in which a person consistently shows no regard for right and wrong and ignores the feelings and rights of others. It affects about 4% of the population in the US, roughly 1 in 25 people, 3% male and 1% female. Individuals with antisocial personality disorder often violate the law, becoming criminals. They may lie, behave violently or impulsively, and have problems with drug and alcohol abuse. There are two main types of antisocial personality disorders, psychopathy and sociopathy. But before learning about the distinction, you have to know about the causes, symptoms, and treatments of both. The exact cause of antisocial personality disorder isn't known, but genes may make you more vulnerable to developing the disorder, and life situations may trigger its development. Certain factors seem to increase the risk of developing antisocial personality disorder, such as diagnosis of childhood conduct disorders, family history of antisocial personality disorder or other personality disorders or mental illnesses, or being subjected to abuse or neglect during childhood, as well as an unstable, violent, or chaotic family life during childhood. According to the Mayo Clinic, these are the symptoms associated with antisocial personality disorder. However, like most disorders, antisocial personality disorder operates on a spectrum, meaning that the symptoms range from mild to severe. Most people are diagnosed before the age of 18. However, symptoms may occur as early as 15 or in childhood in the form of a conduct disorder. There is no way to cure antisocial personality disorder. However, talk therapy or psychotherapy has been shown to help deal with the symptoms. The earlier the therapy begins, the better for the patient. Antisocial personality disorder is also associated with other conditions such as anxiety or depression, as well as drug abuse and alcohol abuse. So medications may be prescribed to treat anxiety or depression or aggressive behavior. However, because of the drug and alcohol abuse, they are not prescribed often and sparingly. As of right now, there is no medication that can help treat the disorder itself. Sociopaths and psychopaths are both disorders under the heading of antisocial personality disorder. They are often used interchangeably. However, there are some major differences between them, the most obvious difference being how they act around others. Sociopaths tend to be more socially awkward and have a harder time integrating into society, while psychopaths often learn how to mimic emotions, allowing them to blend into society and sometimes even have families. The cause of psychopathy is also different than the cause of sociopathy. Psychopathy is believed to be largely the result of genetics. It results from underdevelopment in the part of the brain responsible for impulse control and emotions. Sociopathy, on the other hand, is largely the result of childhood trauma or abuse. The main similarity between the two is the lack of empathy, or lack of the ability to understand the feelings of others. However, because sociopathy is learned, it is possible for sociopaths to have empathy in certain situations. This lack of empathy leads to a major stigma surrounding the disorder. Stigma plays a large role in any mental illness or disorder. A stigma is a mark of disgrace associated with a particular circumstance, quality, or person. For antisocial personality disorder, the stigma largely comes from media, such as TV, movies, or books. Media tends to represent disorders in their extremes. Characters like Hannibal Lecter, Dexter Morgan, and Sherlock Holmes are examples of this, with all of them either characterizing the extremes of the disorder or misrepresenting the disorder as a whole. It is a fact that people with this disorder have a higher chance of becoming a criminal, with about 40% of the worldwide prison population having antisocial personality disorder. However, not every person with antisocial personality disorder becomes a serial killer or a crime-solving genius, as the media may lead you to believe.